So thank you everyone to assist to this webinar. It's my pleasure. It's an honor to collaborate with this network. So I'm gonna talk about ethics in ethics in health research. So this is my topic. This is a short agenda that what we will talking in this webinar. We're gonna talk about health research, artificial intelligence, and ethics and regulation. But focuses on bioethics. Well, in health research, in health research is indispensable to solving public health challenges. Whatever, this is addressing the disease of poverty, responding to the rise of chronic disease, or ensuring mothers to have access to safe childbirth practice. These are some areas, you can see here some areas of health research. We can measure the distribution of and the magnitude of health problem. In the COVID-19, this is an example of how it's important the health research to understand the behavior of the disease, understand the causes of the determinant of the problem, whether due to biological, behavior, social, and environmental factors. Develop solutions or intervention to prevent or mitigate the problem. Implementation of delivery solutions through policies or health program. And finally, to evaluate the impact of this solution, because if we implement something, we need to measure to understand if this is possible or to get a good effect. Okay, so health research, we have a gap. What is the gap? This is scientific knowledge is advancing too fast. Okay, we develop and generate evidences every minute, but the problem is that research evidence is not too faster. It doesn't have a faster implementation in the clinical practice, for example. And what happened with that? But we need to understand the relation between practical evidence based. We have the clinical experience, the scientific evidence, and the patient values. So if we do health research, we need to implement this evidence and translate into the practice of the clinical practice, but using the best evidence possible and the patient values. And there is a need for new knowledge to be applied and translated into better health. And this is the gap. Today, society expects decisions to be based on the best available knowledge, but research initiatives are still not adequately organized or managed. This is when it enters the artificial intelligence. The artificial intelligence, a couple of years ago, we know the existence of ChatGPT. 546 million of people use ChatGPT in the world. The artificial intelligence is the ability of algorithm to encode the technological means to learn from data in order to perform automated tasks without a person explicitly programming or each step for process. And today we are talking about generative AI, for example, artificial intelligence, to create content, to create solutions. But one of the ethical issues is where that AI is getting that information. What is the source of the algorithms? And we are going to talk about it in this presentation. The World Health Organization recognized that the artificial intelligence holds great promise for the practice of public health and medicine. The ethical issue that artificial intelligence entails for health system and service must be addressed. This is the application of the artificial intelligence to health. In medicine, we can right now we can improve diagnosis and treatment. In the health administration, we use AI for assistance and logistics tasks. And public health using right now in surveillance. And what is the best example was in COVID-19 surveillance, for example, in health promotion and prevention. And in research, we in pharmacology, we develop drugs with precision medicine to get better health results or health outcomes. Understanding the problem, we have some implications and concerns. The implication is what I was mentioned, because there is a Russian adoption of unproven system that could lead to errors by healthcare steps, cause harm to patient, erode the trust in AI, and thereby undermine or delay the potential long-term benefits uses for such technology worldwide. In the conserve, we have biased data, wrong answers, data without consent. The post-truth, this is a concept what was very famous in the past 2 or 3 years, because today with the post-truth and the fake news, and if the AI use that information to develop the algorithm, we are not able to distinguish what is real or what is unreal, and we have some security. The ethics and regulation enter to this conversations, because we have we need a moral ethics framework. Ethics is the ability of algorithm to encode in technological mean, right? The World Health Organization made these ethical principles. We have the autonomy first, so people have the ability to decide what they think that is better for his own life. People must be respected. People have to respect the values. Okay, in the benefit sense, we have the moral obligation to act in the benefits of the patient or the society or the community in general. We have to put away those PI feelings, the PI aims, and we have to embrace the community needs. Okay, so we have the equity, the in terms of justice. We need to all the benefits of the project. We need to think about how the project will be develop benefits in all the community, thinking in vulnerable groups, for example, in women's and children's, LGBT community, for example, and others. So in non-malefic sense, we have the prudence. We don't know, we can't cause harm to participant society. If you use the artificial intelligence or some resource solution in a project, this you don't have to harm. Okay, this is the framework of ethics, governance, and regulation of artificial intelligence from WHO. Tedros Adhanom, he's the director of World Health Organization. He said that AI holds a great promise to health, but also presents significant challenge, including unethical data collection, cybersecurity threats, and the rise of bias and misinformation. That's what we are talking. This is the ethical principle in AI for health. We have autonomy, protect the human autonomy, to promote the responsibility and accountability, the well-being, to promote the welfare and safety of people in the public interest, ensure inclusivity and equity, transparency, ensuring transparency, clarity, and intelligibility, and sustainability to promote responsible and sustainable AI. So, in ethical challenge, what is the ethical challenge in health research with AI? We have the privacy and confidentiality, the use of sensitivity patient data and algorithms. You know, always we're having some misinformation. You know, the AI receive data from patients, for example, clinical history. So we need to act according to the local regulation. The fairness and algorithmic bias, algorithms trained with bias and discriminatory decisions. And this, we see this in the past at the beginning of the AI era. So if the program, if he developed an AI without this considering the equity, considering the respect of the dignity of the participant, the AI will act with discriminatory decisions. The imputability and explainability. The lack of transparency in algorithms makes it difficult to understand decisions. So we need to adopt an open code. Responsibility and supervision, clear assignment of development responsibility. So what is the strategies to address the challenge? We have to implement in the research project and ethical design. This is when we start with the ethics in a project started at the beginning at the planning phases. So integration of ethical principles from the beginning, the transparency, the disclose the bias and limitation of the promote accountability, the community participation to involve in decision making to ensure representation, but this community participation must be in the beginning of the study. So if we involve the community in the planning phase in designing the study, this will ensure a better health outcome for the community, because you trust, and the community trusts, that all the needs will be taken in count of the project. Finally, all projects must have an ethical evaluation. Institute review board must be review the project according to the ethical principles. For example, the use of informed consent, the social value, scientific value, and respect for participants, taking taking care about the risk and benefits, etc. So my conclusions are that ethical principles include fundamental ethical principles, specific challenges in AI research. We should address the challenge, importance, addressing this ethical challenge to ensure integrity, equity, and safety in health research. There is a call to action to adopt robust ethical principle approach in developing and implementing an AI for healthcare. Bill Gates, this is a quote: artificial intelligence will change everything. So thank you. You can email me, or if you have any question this is my Twitter account. Okay, so thank you again.